Hello, Washington chiropractors. The Chiropractic Quality Assurance Commission met on Monday to update its guidelines for DCs practicing during the COVID-19 pandemic. These updated guidelines will bring the profession more in line with the best practices being applied to all healthcare professions. Most chiropractors are already observing these recommendations, so you probably won't have to make many changes. Nevertheless, we wanted to report the adopted guidelines so that anyone who is still seeing patients can keep themselves in compliance. The Commission will release its own finalized document in the coming days, but the 9 guidelines they approved on Monday are recapped as follows. Number 1. At this time, in-person chiropractic care should be limited to urgent health issues. All others should be postponed. What constitutes an urgent health issue? Well, that's up to your professional judgment, but some examples may include acute pain, conditions that will worsen if left untreated, and treatment of essential healthcare workers and public safety workers that keeps them on the job. Number 2, when appropriate, deliver care via telehealth and/or advise your patients to implement self-care measures until non-essential activity restrictions are lifted. For more information about implementing telehealth or the tools that you can use, contact the WSCA. We'll have a webinar on the topic on Friday, April 10th, and thereafter it will be available on demand. Number 3, prior to allowing patients, staff, or providers into your clinic, screen them for COVID-19 symptoms. If they are symptomatic, send them home or refer them to the appropriate provider. The symptoms to look for are fever, coughing, and difficulty breathing. Number 4, ensure proper social distancing with a minimum of 6 feet between people in your clinic. Now obviously, when you provide an adjustment, you're going to have to go within that 6-foot limit. But once the adjustment is completed, immediately go back to your 6-foot distance. Number 5, for providers and staff who will be within 6 feet of another person, the Commission strongly suggests that they wear masks. These don't need to be N95 or surgical masks. Cloth mask will do. But the Commission does strongly suggest that you wear a mask if you're within 6 feet of another person. You may also encourage your patients to do so as well. Number 6, continue to follow CDC guidelines for hand hygiene and clean your facilities and equipment in between each patient. Number 7, if necessary to maintain appropriate physical distancing, have your patients wait outside until the previous patient has left and cleaning has been completed. Stagger your appointments to minimize contact between patients, and bring your patients directly into the treatment area as quickly as possible. Number 8, if you're still having patients sign in, use a single sheet of paper for each patient. And number 9, allow all employees who feel uncomfortable working in the clinic to remain home or work remotely if possible. Again, most of you have already been implementing these best practices to one degree or another. And I'm happy to report that since the beginning of this pandemic, Washington chiropractors have been especially proactive about implementing them. So really, we just need to keep up what we're doing. And if there is 1 or 2 guidelines that you haven't implemented yet, it shouldn't be too difficult for you to do so now. The curve is flattening throughout Washington, and I firmly believe that chiropractic played a part in that. Still, there are some people who don't quite understand why chiropractors are practicing now. If you haven't already, print out the patient infographic that we provided earlier this week, which illustrates the role that DCs play in combating this pandemic. The link to download the infographic is below this video in the newsletter. Finally, as always, continue directing your questions and concerns to the WSCA. We're here helping chiropractors help patients.